Every 40 seconds, someone has a heart attack. If you are over 60, the risk climbs fast, even when you feel fine. Here is the part few people hear. Most heart attacks begin long before chest pain, with a quiet injury to the inner lining of your arteries. That injury builds unstable plaque that can burst on any ordinary day. One hidden cause drives much of it, and you can start fixing it tonight. A quick note before we dive in. Nighttime dizziness and bathroom trips also raise injury risk after 60, and a bad fall can change your life in one day. This video is educational and not medical advice. Always talk with your healthcare provider. After 60, your arteries act differently. The flexible lining, called the endothelium, becomes less responsive. Tiny cracks form more easily under pressure and sugar spikes. Cholesterol particles slip into the wall, and your immune system, now slower and more inflamed, tries to clean up. That cleanup can turn into a hot, swollen plaque. A sudden stress, a surge of blood pressure, or a cold morning can make that plaque rupture and trigger a clot. Hormone shifts, poor sleep, and common medicines change the picture too. Diuretics can leave you a little dehydrated. Decongestants can raise blood pressure. Antacids can lower magnesium. Add long chair time, salty processed foods, and unrecognized sleep apnea, and your arteries get a daily drip of damage. The hidden cause underneath these pieces is endothelial inflammation, fed by a high burden of atherogenic apoptotic particles and repeated spikes in pressure and sugar. The good news is simple and strong. Small steps lower the burden, cool the fire, and stabilize plaque so it is less likely to burst. Welcome to your weekly guide to staying strong, sharp, and independent after 60. I translate solid science into clear steps you can use tonight. If that sounds good, tap like and subscribe so you do not miss a tip. Tell me your country in the comments so I can match food labels and clinic options to your world. Let's count down 7 artery-saving habits, from helpful to the most important move to discuss with your doctor. Habit number 7, sitting most of the day. You might finish breakfast, read, answer emails, and suddenly notice you have barely moved. Long sitting is more than stiff hips. It is a steady hit to your blood vessels. When you stay still, blood pools, fats linger longer, and your artery lining gets fewer healthy signals from muscle contractions. For older adults, this matters more because circulation is slower and insulin works less efficiently. According to the American Heart Association scientific statement in 2020, prolonged sedentary time is linked with higher risks of cardiovascular disease and death, even after accounting for exercise. The mechanism is simple. Muscle movement pulls sugar and fats out of the blood. No movement means more time for those particles to irritate the artery wall. Short term, you feel sluggish and your blood pressure creeps up by evening. Long term, day after day, plaque builds and becomes easier to inflame. Start easy tonight. Set a gentle timer for every 30 to 40 minutes during TV time. Stand, march in place, or walk to the kitchen and back for 2 minutes. Put the remote or phone across the room so you have to get up. Keep a light pair of walking shoes by your chair to make moving simpler. If you feel woozy when you stand, rise slowly and hold a stable surface first. Up next is the pantry habit that raises pressure and swells plaques, even when the package looks healthy. Habit number 6, letting salty, ultra-processed foods run your menu. Canned soups, frozen dinners, deli meats, instant noodles, and snack foods are quick and tasty. After 60, they hit harder. Sodium raises blood pressure more in older adults, and refined starches and low fiber push sugar spikes higher. Both damage the lining of your arteries. The Centers for Disease Control and Prevention has reported for years that most adults exceed sodium limits, with mixed dishes and breads leading the list. A cohort study in the BMJ in 2019 linked higher intake of ultra-processed foods with more cardiovascular events over time. Mechanism in plain words. Salt pulls more water into your bloodstream, raising pressure against the artery wall. Fast carbs flood the blood and feed inflammatory signals inside plaques. Short term, you notice swelling in your fingers, puffy ankles, and restless sleep. Long term, pressure and sugar swings make plaques softer, more inflamed, and easier to rupture. Make tonight simple. Swap one high-sodium item for a low-sodium version and add your own herbs, garlic, or lemon for flavor. Rinse canned beans and vegetables to wash off extra salt. Build half your dinner plate with vegetables and a quarter with a lean protein, so sugar rises slower. Pour water into a real glass before you open a snack. If you check blood pressure at home, log your evening and morning numbers for a week and share them with your clinician. Up next is the quiet killer many people miss because it rarely hurts until it is dangerous. Habit number 5, skipping blood pressure checks and targets. High blood pressure is called the silent killer for a reason. You can feel okay while your arteries take a beating. With age, vessels stiffen and pressure surges do more damage to the inner lining. According to the American Heart Association and American College of Cardiology guidelines from 2017 and updates since, controlling blood pressure reduces heart attacks and strokes. Research from the SPRINT trial in 2015 showed that tighter control in selected older adults lowered cardiovascular events under close medical care. Mechanism is clear. Every surge of pressure adds tiny cracks in the lining. The body patches them with cholesterol-rich plaque. Over time, that plaque becomes unstable. Short-term, unrecognized highs trigger headaches or dizziness when you stand. Long-term, plaque grows silently until a clot forms on a small rupture. Take control tonight. Sit with your feet flat for 5 minutes and check your pressure with a validated cuff. Record the reading, the time, and what you are doing. Do this on several days at different times. Ask your clinician what your personal target should be and whether your medicines need an update. Space evening water and bathroom trips so you are not stumbling at night. If your numbers run high, plan a salt audit and a daily walk. Up next is the nighttime problem that jolts your heart and brain hundreds of times without you knowing. Habit number 4, ignoring snoring and sleep apnea. Snoring is not just a noise. In sleep apnea, your airway collapses repeatedly. Oxygen falls, stress hormones surge, and blood pressure spikes over and over. That is hard on your arteries. The American Academy of Sleep Medicine notes that untreated sleep apnea is linked with hypertension, atrial fibrillation, heart attacks, and strokes, and that treatment improves blood pressure and daytime function. Mechanism in plain words. Each pause in breathing sets off an internal alarm. Your body releases adrenaline, squeezes blood vessels, and stirs the plaque pot. Short term, you wake unrefreshed and nap in the afternoon, which cuts activity and worsens sugar control. Long term, the nightly spikes keep plaques unstable and strain your heart. Screen yourself tonight. If you snore, gasp, wake with a dry mouth, or have morning headaches, ask your clinician about a home sleep test. Side sleeping, reducing evening alcohol, and keeping your nose clear can help mild cases. If apnea is confirmed, modern CPAP machines are quieter and more comfortable than many people expect, and they often change lives. Keep your path to the bathroom lit, so groggy wake-ups do not become falls. Up next is a mouth problem that many people shrug off, but it keeps artery inflammation smoldering. Habit number 3, letting gum disease simmer. Sore, bleeding gums are common, but they are not harmless. The same bacteria and inflammatory signals that irritate your gums can enter your bloodstream. Research summarized by the American Heart Association in 2012 reported an association between periodontal disease and atherosclerotic heart disease, likely through shared risk factors and inflammation. Studies in the Journal of Periodontology have linked active gum disease with higher inflammatory markers like C-reactive protein. Mechanism is straightforward. Inflamed gums act like an open door. Bacteria and their products travel. Your liver makes more inflammatory proteins, and plaques stay hot. Short term, you notice tender gums and bad breath. Long term, untreated gum disease can lead to tooth loss and higher overall inflammation that worsens artery health. Start tonight. Brush gently for 2 minutes with a soft brush and fluoride toothpaste. Clean between teeth with floss or an interdental brush. Swish with a simple fluoride rinse if your dentist recommends it. Sip water after meals to wash away food. If your gums bleed, schedule a cleaning and ask about periodontal treatment. Calmer gums mean calmer arteries. Up next is the sugar story that is really about your blood vessels, your nerves, and your heart. Habit number 2, riding daily sugar spikes. A sweet breakfast, a big juice, and a nap can feel easy. Those swings are hard on arteries. Repeated glucose spikes lead to glycation and oxidative stress that injure the endothelium. Insulin resistance then keeps sugar and fats higher for longer. The American Diabetes Association reports that heart disease is the leading cause of death in adults with diabetes, and that better glucose and blood pressure control improves outcomes. Mechanism in plain language. High sugar roughens the inner surface of your vessels, making it easier for cholesterol to stick. High insulin and triglycerides add more fuel to plaque. Short term, you get energy crashes and nighttime bathroom trips that raise fall risk. Long term, you grow softer, more inflamed plaques that are easier to rupture. Turn the day around tonight. Build meals around vegetables, beans, fish, or lean meat, and intact grains. Eat protein and fiber first, so sugar rises slower. Take a 10-minute walk after meals to pull sugar into muscles. If you monitor glucose, see how different dinners change your numbers and your sleep. Ask your clinician whether you should check in a 1C, a fasting glucose, or a 2-hour glucose, and whether a nutrition visit could help. Up next is number 1, because it targets the hidden cause at its root and gives you a clear medical plan. Habit number 1, not knowing you're a POB and your plaque stabilizing plan. Here is the hidden cause in one sentence. Too many atherogenic particles, carried by a POB, slip into your artery wall and feed inflammation until a plaque ruptures. Many people watch total cholesterol or even LDL cholesterol and still miss the true burden of particles. Research summarized in the American Heart Association's 2019 Prevention Guideline and other expert statements notes that ApoB, or non-HDL cholesterol, can better capture atherogenic particle load, especially when triglycerides are high. Mechanism in plain words. More ApoB particles mean more chances to lodge in the wall. Your immune system reacts, the plaque grows, and if it is thin-capped and inflamed, it can burst. Short term, nothing feels different, which is why this stays hidden. Long term, an unstable plaque can rupture on a quiet morning walk. Take action now. Ask your clinician to review your full risk, including blood pressure, diabetes status, kidney function, and family history of early heart disease. Request non-HDL cholesterol or a POB if appropriate, and ask whether a coronary artery calcium scan would help guide decisions. Discuss lifestyle steps you can start tonight, and whether medicines like statins or ezetimibe are right for you. Aim for fiber-rich meals, daily walking, and steady sleep to lower inflammation. Never stop or start heart medicines on your own. If you ever feel chest pressure, neck or jaw pain, shortness of breath, or sudden nausea, call emergency services immediately. You stood up to long sitting by adding brief movement breaks so blood flows and vessels relax. You trimmed salty, ultra-processed foods so pressure and sugar stayed steadier. You checked blood pressure at home and set a personal target with your clinician. You screened for snoring and sleep apnea to stop nightly pressure spikes. You treated sore gums so mouth inflammation stopped fueling your arteries. You leveled out sugar swings with protein, fiber, and short walks. You learned the hidden cause is excess APOB particles that inflame the artery lining, and you asked for a plan to lower and stabilize plaque. Which one surprised you most? Tell me in the comments and add your country so I can tailor grocery and clinic tips to you. If this helped, tap like and subscribe for weekly steps that protect your heart, your balance, and your independence.